Okay, start over. This is YouTube.
Man, I can't. At least we have fun here. Good morning, everyone. Welcome to our March meeting. We do have a presentation by Melissa Centillas today from Planned Parenthood. Melissa is here somewhere. There she is. We'll do a quick introduction and then we'll get into our business. I'm Spirit Circus, president of the IAC and director of Youth Services and Recreation for the city of Glenkova.
I'm Nancy Ruhenfeld and I represent the Alberta Hersey Foundation.
Gabor, I guess you can go and I'll just.
Gabor Karsai, treasurer of IAC representing Rotary International.
And Carolyn?
Carolyn Wilson, vice president of IAC. Oh, and representing the North Shore Historical Museum.
Thank you. Jamae?
Crowder, also on the board of the IAC and the Glen Cove Chamber, and I am representing Tigerman.
Phyllis?
Hi, I represent the Kiwanis Club of Glen Cove.
Francesca?
Hi, I'm Francesca Carbone and I'm the social worker for SAFE.
Christine?
Christine Rice, Executive Director of the Glen Cove Senior Center.
Travis?
Travis Heat, pastor at Trinity Lutheran Church in Glen Cove.
And Travis will be staying with us. He is not moving to Massachusetts, so it's good news.
Thanks.
Amy? Ms. Eisenberg?
Hi, okay. Hi, I'm sorry, I'm driving and I'm listening at the same time. Amy Eisenberg, representing the Regency Assisted Living in Glen Cove.
This is better than a podcast, you gotta admit.
Totally, I'm enjoying it.
Maria?
Hi, I'm Maria Venuto. I'm a board of ed member representing the school district today.
Morning.
Thank you.
Tony?
Hi, everybody. Tony Jimenez, Glen Cove Veterans Affairs.
Colleen?
Good morning, Colleen Spinello. I'm representing the Church of St. Rocco, and also I'm a board member of IAC.
Melissa?
Hi, everyone. I'm Melissa Centillas, and I'm one of the Family Planning Benefit Program trainers over at Planned Parenthood Greater New York.
Welcome. Maureen?
Good morning, Maureen Bastavillanis, Deputy Mayor, City of Glen Cove.
Morning. Ron?
Hi, Ron Roel, representing AARP.
Morning. And
Morning.
we have Vasiliana.
Hi, good morning. I'm Vasiliana Fakiris from the Church of the Holy Resurrection.
Welcome. And I don't know who iPhone is, but Franca is here as well.
Jorge Carreras, La Fuerza Unida.
Oh.
Hi, good morning,
Jorge.
Franca,
Morning.
Glen Cove Boys and Girls Club.
Morning, Franca. All right, so we'll get started with Melissa's presentation and then we'll go through everything else we have to do. Is somebody else just joining in or is it the same person?
No, it's same person.
Jorge Carreras, La Fuerza Unida.
Morning, Jorge.
How are you?
Good, buddy. All right, Melissa, you can get started.
Okay, quick question. Am I able to share my screen or do I have to be made?
Let me check for you.
Gabor is, very.
Yes, you can now.
The board might charge you for sharing your screen. Might need some money for that. You see.
Oh, man.
Okay, now I want triple salary.
Pleasure.
You got it?
Yeah, you can share
Okay,
this.
you could try to do it. Yeah.
Okay.
Yes. I apologize on behalf of Travis.
Okay, is everyone seeing the screen?
Yes.
I can see it.
Okay. All right, thank you. So I know I had an opportunity to introduce myself, but once again, I'm Melissa. I am one of the Family Planning Benefit Program trainers over at PPGNY. And with today's presentation, I just want to go over quickly the Family Planning Benefit Program, what it is, what it covers, and how you can gain access to it at Planned Parenthood of Greater New York. So just a little bit about PPGNY. We did go through a merger early last year. So a lot of our sites out here on Long Island, especially in Nassau County, were known as Planned Parenthood of Nassau County, but currently we are all known now as Planned Parenthood of Greater New York. So there's about 31 counties across the state that we serve. We have 30 plus locations. This includes both health centers and mobile health centers that we have. And then we also have, a wide range of different sexual and reproductive health care services that we offer at different sites, including prenatal care, primary care, STI and STD testing and treatment, wellness exams, medication, and HIV testing and counseling as well. So that's just a brief overview of some of the services that we do offer. And one thing that I want to state is that through COVID, we have remained open with a few closures. One of those closures including our Glenkova site, but regardless, for our other sites, we have remained open, and our biggest mission is really just to serve everyone regardless of their age, their gender, their immigration status, or their ability to pay. So the Family Planning Benefit Program, or also known as FBIB, is essentially a free and confidential public health insurance program that we offer at PPGNY. So this is a New York State Department of Health funded program. It is also a Medicaid program, and it's just kind of filtered out through Planned Parenthood. So essentially, all family planning services are covered under this program if an applicant is deemed eligible, and we will go over what makes an applicant or a patient eligible. But one really great thing about this program is that applicants can be insured, underinsured, or have no insurance at all. And if they meet the eligibility requirements, they can get covered under this program. I just want to emphasize that this program, FBIB, is a Medicaid program. So for individuals who already have comprehensive Medicaid, they would be deemed ineligible because essentially what is covered under Medicaid is covered under this program. So they would be deemed ineligible. And then lastly, another great aspect of this program is that we do have same-day coverage, which our financial counselors call presumptive eligibility. So usually if an applicant comes in or a patient comes in for a, let's say a birth control appointment, if they say, hey, I think I meet all of the eligibility requirements, before we ask them to come back a few days later with all of the paperwork proving their eligibility, they can just attest to the fact that they're eligible, and that same day have a visit at our sites that is completely free. So in terms of covered services, this is just a few of the things that are covered under the program, but STD, HIV testing, all FDA approved birth control methods, emergency contraceptives, a well person visit, which would be like a wellness visit, transportation to and from family planning visits, screening for cervical cancer and urinary infections, vasectomy and tubal ligations for adults, and so much more is covered under the program. So what makes someone eligible? So the state asks that those who apply are a New York State resident, that they are either a US citizen or lawfully present within the United States, that they have an income that meets the federal poverty level 2020 guidelines, and that they do have the ability to have children or they are within their reproductive years. So in terms of like income, we do have financial counselors at our sites that will walk a patient through the steps of applying. So I know this may seem very complicated, what is the 2020 federal poverty level guidelines? But once again, our financial counselors will walk you through the steps to see whether or not you are eligible. So these are the requirements that someone can attest to if they walk in and say, hey, I think I may be eligible for FBIB. I meet all of these requirements, and they can receive same-day coverage. So lastly, in terms of how long you will be covered, we have 3 forms of coverage. So the first being presumptive eligibility, which is immediate temporary coverage. This is the same day coverage that I was speaking about earlier. Then we have 12 months of coverage, so a full year of being able to come in and out of our sites, knowing that your visits are completely free. And then lastly, we have retroactive coverage. So if you came into our sites 3 months prior to receive birth control or had a family planning visit, and then you come 3 months later and you hear about the program and you realize that you could be covered, the visit that you had 3 months earlier can be considered free, as well as the visit that you have currently. So lastly, we kind of like how we're meeting now because of COVID, you know, being at home through a laptop, we do have telehealth services. I can pull up the website if anyone's interested in terms of seeing how you can book an appointment, but essentially, you know, with COVID, it may be easier for a lot of people to meet through a screen if they do not have the time or are unsure of traveling to one of our medical sites. So you can call the number 1-800-230-PLAN, or you can go onto our Planned Parenthood of Greater New York website. Along with that, we also have our Project Street Beat Mobile Health Center, which is essentially a big bus that we have that parks at different locations. This is more so for our sites and our community out in like the New York City region. But for our Hempstead location, we do have what's called the Plan Van, which will also park in different spots or different campuses for different students or patients to come onto the van and get tested or sign up for an appointment. So I know this was really quick. I wanted to make it really brief. I know it's a lot of information. I can stop sharing this presentation and maybe show the website if anyone's interested, or I can answer questions. I just want to gauge where everyone is at. I know I kind of spoke like fast.
Melissa, any idea when the Glenkova location will be opening on?
So we are in the midst of having a few meetings about some openings and closures. The second I hear, I can of course send an email over to you. We do know that with COVID, one of our biggest things with, unfortunately, some of the closures is making sure that we close that gap for where a center is closed and making sure that community is still served. So that's why I wanted to come, and use this opportunity to share that we are still open, that it may just have to be another site that some patients will have to go to. But we do have telehealth, which for some people may be a bit easier, meeting someone over the phone or over a laptop. But the second I hear, I definitely will send an email over.
So the closest location for Glen Cove resident would be the Hempstead one?
So we do have the Hempstead site. Are you still seeing my screen?
Yes.
Okay, so this is our PPGNY website, and this is where you can go online to book an appointment. So I will put the Glen Cove location. So as you can see, it'll say that there's 50 centers nearest to where Glen Cove is. And if we scroll down, currently Glen Cove is closed. So if we scroll down further, New Rochelle would be the closest. It gives you an idea of the hours that they are open, some of the services that would be available both in person and through telehealth. And so these are some of the other centers. So Huntington, and then here we have Hempstead. As you can see, you can book the appointment online. It'll give you an idea of what time is available for that specific day, location, the phone number. So that's just a little bit of information on how to navigate the website.
Melissa, this is Franca from Glen Cove Boys and Girls Club. I was
Hi,
just
how are you?
curious. Good. I was just curious if you still offer educational, the educational services to youth. I know in the past there's been.
Let me make sure I'm muted.
In the past, I think there's been some instructors who've been able to come out to sites.
Mm-hmm.
Is that still available? I mean, I don't know if they'd be able to come out to sites, but are the educational workshops still available?
We do have workshops. I'm unsure, so I don't personally do the workshop. I mainly focus on just this programming, but we do have some individuals in our education department that work with youth. I can send an email out to them to see if they would be comfortable coming out to meet you physically, or if maybe they can do like a virtual training. But if you could send me your email, I definitely can put you in connection with someone who could provide those services.
Okay, great. So I'll just send you an email and then I can connect with whoever's in charge of that.
Okay, no problem.
All right, great. Thank you.
Is there an expected timeline as to when the Glen Cove location will be opening again?
Currently, I do not have that information. I know there's been a lot of talks with the higher ups as to when there would be opening and closures of different locations. But I would think probably within the next week or two that we would get an answer, because it's been a while. So once again, once I get that information, I'll be sure to share it with everyone within the Glen Cove community.
Anyone else have any questions?
Yeah, Tony Jimenez. Hello?
Yes, Tony, you can go.
Okay, thank you. Question, you've covered the eligibility, and you were kind of talking about the financially insecured. Is your business open to everyone?
Yes, absolutely. So I should have emphasized that earlier. This is just one program that we offer. If someone is deemed ineligible for the program for whatever reason, regardless of their ability to pay, they can still come into one of our Planned Parenthood sites and receive care. This is just one program that we offer to kind of, alleviate that stress of maybe not knowing whether someone can pay, and if they're eligible, they know that they can be receive care free for an entire year. But regardless of someone's ability to pay, or if they're eligible for the program, they can of course still come in and receive care. And we'll make sure we have like a sliding scale fee. So we would assess their income and try to give them whatever service that they are looking for at the cheapest that we can give it to them.
Thank you. And one follow-up question. Those that are presumptive eligible, and you're later found out that you're not eligible, do you get billed for the presumptive care that you might have gotten?
No, they are not billed. Essentially, if they are testing there's no consequences. So right. And essentially, if they, as a financial counselor, as someone who has helped someone fill out an application, if they are attesting to their eligibility, I'm trusting that they are. And so if it comes out later on that they are not, there are no consequences.
Okay, very good. Thank you.
No problem.
Excuse me, Melissa, this is Phyllis. Does the Planned Parenthood take care of seniors?
Mm-hmm. Yes, regardless of age, race, immigration status, if you're looking for care, you can come in and whatever services you're looking for, we can provide it or give you the resources or connections to another organization that can provide that care.
Okay. Thank you.
No problem.
Hi, Melissa. It's Maureen Bastavanis. Can you just tell me how long has the Glen Cove location been closed?
I definitely want to say upwards of, probably more than 6 months at this point. I'm not sure as to when the initial closure happened, but I know, easily all through fall, it was closed, and I think even early summer. I personally cannot attest to why that specific location was closed. I don't have that information under my belt, but I would have to guess in terms of finances on our end, and being to uphold, having the ability to uphold that center may have pushed it to be closed. But I know they're working very hard in terms of figuring out what locations will be open, what may possibly remain closed or permanently closed with everything happening with COVID. So.
Okay, that was kind of, where I was going with it was, did it actually close due to COVID and due to issues with COVID restrictions and guidelines? Was that it, or was it more like a internal thing that they, had planned to close?
Yeah, I personally think it might have been a mixture of both, with everything going on. It just kind of like the perfect storm. But yeah, I know that they're working very hard to figure out as to when there will be reopenings for our other centers that have been temporarily closed, and if there will be permanent closures that are happening. So.
And were all those people that were patients at the Glenkova Center, were they all rerouted to other locations? Yeah,
absolutely. Our biggest thing is, in the midst of COVID, even though other centers remained opened, is making sure that we're creating that gap. And so, at least in my mind, with the outreach that I do in different communities, whether Glenkova is temporarily closed or permanently closed or reopens, my biggest thing is making sure that that gap is closed in the Glenkova community, and so that there's still an access or stream of care that is still being provided. So we're definitely making that a big priority of ours.
Yeah, I would think that a lot of the patients from the Glenkova site, because we have such a diverse community and a lot of underserved areas, that having that location right here is such a benefit, because I'm sure many of those people, it's difficult for them to find transportation to be able to get to Hempstead or wherever else. So it's very convenient to be able to have a site right here in Glenkova. So if there's anything we can do to kind of help to, make sure that that reopens, it would, just let us know.
Yeah, absolutely. Thank you for that. I really appreciate hearing the input of those who are, in the community that can give me, their personal insight. And I'll be sure to relay that to my directors and supervisors. So thank you.
Thank you.
Any other questions? All right, Melissa, do you mind just stop screen sharing? Because I kind of can't see anyone else if they have anything.
No problem. Thank you so much for letting me share.
No, thank you for coming. Really quick, it wasn't on the schedule, so my board, please don't kill me, but I had a conversation with Ms. Fakiris this week, and she has a project that her son and a couple of the kids are looking to work on, which I think will be great. It's just a matter of logistically trying to figure out how we can do this. But before I butcher the project, I just want Vasiliana, do you mind just speaking about it really quick and letting everybody know, and we could see how we can work together on this?
Sure. Thank you, Spiro. Yes, so we're working on a project. It's through Be the Match, which is a bone marrow donor registry. And we're looking to help people swab their cheeks if they're interested in being a donor, to basically, it's the gift of life, help save a life. So I don't know how many of you know this, but a bone marrow is given to someone that might have cancer or another deadly disease. When someone is looking to have a bone marrow transplant, they look to their own family, but sometimes your family members cannot be a match. So then you look into the bone marrow registry, which is, there are a couple of them, but Be the Match is one of the largest registries. And there are volunteers who have donated to be on this registry. So I, for example, have been on the registry for 14 years. I have never gotten a call to save a life. But why is this important? Because people, when somebody in their family is sick, they all seek to do a bone marrow drive so they can help their loved one. So why wait for that time? There's so many people that get sick and they're rushing to find a donor. They might not be able to find a donor. Their family member, whether it's their child, their mother, their father, their sibling, can die if they don't have a match. So what we're looking to do is we're looking to build up the registry, especially some of the communities like the Hispanic or Latino community only has 46% of people on their registry. So if God forbid somebody gets sick, they would then they only have 46% of the people there. So basically what we're looking to do is do a drive-through or a drive where you're 6 feet apart and you're following the current COVID guidelines. And people would come in. You have to be between the ages of 18 to 44 years old. And it's simple. It doesn't cost anything. They take a swab of your cheek, and that's the entire process. You're just swabbing your cheek. And if you get a phone call to be a donor, that's when you have the conversation of, do you want to be a donor? Like, do you want to give your blood to help save somebody's life? But it's confidential. Nobody will know. So that's your decision, but hopefully it is a decision that you want to take when it involves saving a life. But that's basically the process. And patients are most likely to match donors of their same ethnic background. So that's why, anyone can come to go get on the donor registry list, but we're really trying to help the smaller communities and ethnic backgrounds that aren't right now on the donor registry. And I don't know if anybody wants to know how, say you are chosen to give this gift of life, there are 2 ways to do it. And that's where people get scared because they hear, oh, I need to be put to sleep so I can do this. Yes, that's one option, but there's also a simpler option where they take your blood and they do it that way. And you recover within a few days. You don't have to pay for anything. Everything is taken care of from the hospital and wherever the patient might be. So that's, I don't know, Spiro, if that's.
No, that's perfect. So this is something that we can look at and identify, and if it's something that as an IAC or if any one of your agencies would like to run with this, I think it'll be great. But I just wanted Vasiliana to let you guys know about this, and you guys can talk offline and see what we can do to help with this drive as well. Anybody have any questions for Vasiliana before we move forward? Nope. Good. All right, Vasiliana, thank you.
I'm sorry, can I have one question? What was the maximum age was 44? Is that what it was?
Yes, it's 18 to 44 to be swabbed, but I think they keep you because I'm going to be 45 and I will be on the registry. I believe they told me till I'm 55 or 60, but to actually swab, you have to be 18 to 44. And I believe you stay on till you're 55 or 60.
Okay, thank you.
You're welcome.
Anyone else? No. All right. But I know Ron has a few things he'd like to discuss with us as well. But before we go to Ron, Gabor, do you want to do our treasure update? You're muted. Isn't it a great thing? I think you're still muted.
I'm sorry.
There you go.
I emailed everybody the list this morning, and there is one new column in there. It says ads, and it says featured next to some. Do you see the list on the screen?
Mm-hmm.
Okay, so this is, we are having ads every month, and we are featuring 4 of our member agencies. We had 2 ads run already, and the new one is going to feature this month the Glenkova Child Daycare, Glenkova Senior Center, SAFE, and the Trinity Church. And that's the column on when a member organization is being featured, then we just put in featured. We have a total of 26 organization paid. Last year it was 41, and the year before it was 45. So we have a ways to go. And our current balance in the bank is $8,279. Every month, we are being charged $116 for the ads. And that's about it. If there's any questions, I gladly answer.
Really quick, Abor, if you don't mind, can you just tell everybody, I know it says it there, but just the people that we've already featured, just in case.
Sure. St. Paul Episcopal Church, the Tigerman School, North Shore Historical Museum, Glenkova School District, Glenkova Public Library, Glenkova City, or the City of Glenkova, Glenkova Hospital, and the Church of San Rocco. These were the 8 that were featured, and there's going to be 4 every month going forward. We are trying to feature the paid ones, but you know, if you cannot pay, that's a different story. But that's what's happening. And also the ad contains our gala date, which is October 1st going forward. And also it has a banner saying that we are 50 years old. We are celebrating our 50th anniversary, short description of us. So that's what's going on. It's all going in the Herald. So look for it. Next week, it's gonna come out. The next ad, it's a quarter-page ad, color ad.
Perfect. Thank you, Gabor.
Thank you.
Hey, Gabor or Spiro, are the agencies selected at random?
What we try to do is stick one youth agency, one city agency, one whether it's a senior agency. So we try to do one of every, of every category. So what we did was, I believe the first one was the City of Glenkova School District, the hospital, and the Episcopal Church. So then the next month we did another church, or I'm sorry, it was St. Rocco's. And the next month it was the Episcopal Church. So we try to go along those lines. We don't want to bombard with 4 youth. We don't want to bombard with 4, so it kind of shows that we're well-rounded.
Okay, gotcha.
All right. If anybody has a particular month that they think is important to them, just, let us know. The original thought was to try and put the speakers in correlation with the month, but it didn't work out that way. So, but we're open to suggestions. Next, on a fun springy note, Colleen, do you want to bring us to date with the beautification, adopt a spot? We should be getting ready soon and to get dirty. You're muted. Muted. Unmuted.
Okay, hi. Yeah, I spoke with Damien down at DPW yesterday, and they're going to do the mulching for us, which gives us a little head start. They're going to do that tomorrow. And then I think if we put in some spring plants and flowers, like pansies and whatnot, that'll hold us over till about May, when we can put in some summer flowers. So if anybody has any extra flowers they want to bring down, I'm going to go out and buy a couple flats of pansies, I think, to put in. I think next week, maybe when the weather warms up, we can start planting. So if you want to contact me, we can get a plan together and we can go down and help. It feels good to get out there and dig in the dirt. I know, Christine, you said you would help me. I didn't forget that.
Please take pictures so we can feature it at the end. Please take pictures.
Yeah, we can feature that. That's a good idea. Take pictures too. And if anybody's doing some spring cleaning and they have some like hardy perennials that they'd like to donate, sometimes when you're cleaning out your garden, you're trying to get rid of some plants to make room for others. It's a really big space, so we could use all the hand-me-down plants we can get. And also keep in mind that they should be drought resistant, because there's no water over there. So we'll have to, take turns and go down and water once in a while also. And that's it. So please, do you have my email address? You can email me or contact me. I'll give you my phone number. It's 516-238-4039. And we'll get it, we'll look at the weather and see what the best day is to go down there, and we'll get organized and make a plan of how to plant. And I figured we'd put some nice cheerful flowers closest to the IAC sign, because it's advertising that it's our 50th anniversary. And like Gabor said, we can take pictures and feature it in our ad also.
I'm sorry, Colleen, where is over there?
Oh, I'm sorry. The IAC Adopt a Spot, it's actually a new spot. If you're looking at the police station on School Street, it's on the left-hand side. It's actually right in front of a school bus stop, and there's a bench too. So it's a big spot. If you look, it's on the left, on the other side of the parking lot. You know, there's the Glenkova police station, and then the entrance to the parking. And then on the other side of that, it's a little patch of land before the building begins. And that's our spot. The sign is there, and there's some old flowers. In the fall, we acquired the spot and we put some mums, but you know, we'll keep planting as the year goes on, the different seasons.
Colleen,
Yes.
if you send me like a day ahead, the time and all, I'll put it out to everybody.
Perfect. Thanks, Carolyn.
Okay.
Any other questions? All right.
Sure, I just wanted to add
Who is
one
that?
thing
Hey,
as well.
yes.
So Gabor had mentioned the ad, and I wanted to also share, we have been sharing it on our social media pages as well. So if you're on Facebook or on LinkedIn, definitely check us out and like our pages if you haven't already. Our LinkedIn page is brand new, so I think have 2 members on it right now. So if you are, like I said, if you're on LinkedIn, go ahead and on there and become a member, a part of our group, and share it. And then our Facebook, you know, if your page, you have a page for your organization, I try to tag your organization monthly when we are also adding you to that ad. And we've been keeping our website up to date as well, as much as we can, the IACGlenkova.org. And that also has up-to-date information about our membership meetings, has information about any members that want to send out something to the whole community. It's listed on there as well. And we try to, again, do that on our social media pages as well.
Have we gotten the updated food pantry? I know we started that. A few people sent it in, and then it kind of stopped.
Yeah, well, it's still on our website, the food pantry calendar. So if it needs to be changed, I know Colleen was working on that end, but if anybody ever needs to know the day and times of when food pantries are running, right now we have the Nosh and the Porch
Pantry.
And we also have the Trinity Lutheran listed. So if there's additional ones that aren't listed.
So we have St. Patrick's also, and
St. Patrick's, I don't see, oh yeah, St. Patrick's, yep.
And St. Rocco's.
St. Patrick's and yeah, exactly. I could show you what I'm looking at. So this is, here, can I only just show you really quick? This is the screen. So this is on our website. And so if you go just straight to community, it goes right to IAC food pantry calendar. So you could share this with whoever, and we try to update this at, you know, Colleen's email is right there. So if you need to update it, you could just go ahead and email her and she'll just update it. And this is, again, monthly. So if somebody, you know, going forward, if the schedule changes, let us know, and so we can update it. But again, this is for you to share with your communities, so you could always print it out and post it, or, you know, email it to your communities as well. So check it out. And then our agencies are all listed here under the specifics. So if you have an agency that's listed incorrectly, as in everybody else wants to make sure you are listed correctly, let us know. If your phone number or your website has changed or anything about that has changed. And then again, if you have somebody that wants to join the IAC, this is the very easy way to get the application and to pay, figure out the dues. So everything hopefully is here for you guys to utilize. This is the homepage, and then this is where our latest news is. And oh yeah, we do have our YouTube page. So our meetings, when you miss them, if you want to watch them afterwards, you can always go to our YouTube page and also subscribe there. We only have like 3 subscribers. All right, I think that's it.
That's
Any
pretty
questions?
bad, because how many are on the executive board?
Yeah,
Wow.
right?
Wow, that's pretty sad.
Get on it, people.
I should just ask my kids to promote it with their social media platforms and who has the most likes. And I can't.
I have
all
to go in a little bit, but just real quick, I don't mean to cut everybody off, but I have to go.
Just
But
cut
a
one.
couple of things are happening in Kiwanis. One is we're having another fundraiser. A lot of you participated in our fundraiser at the Laura's Barbecue, and we had one in McDonald's. We're having another one on April 1st at Panera Bread. If you care to go to our website, which is online, which is on Facebook, and then, or like I can send, once again, I can send it to Carol and then she can blast it out to everybody. But it's going to run on, like I said, Thursday, April 1st from 4 to 8. 20% of the proceeds will come to Kiwanis, which we will disperse into the community. And the other one is something that I've been very passionate about for many, many years. And Kiwanis, Glenkova is finally, we have picked it up. We're calling it the Lady M Project. And what that is that, and for guys who don't want to hear this, you know, you can go la, 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 la. But what we want to do is I want to get all hygiene products, I'm meaning Kotex, sanitary napkins, whatever. And I want to give that to either the Porch Pantry or Nosh so they can distribute it amongst the community. Because one of the things that we don't look at, we're feeding them, but we're not helping a lot of women who do not have the money to provide this. Finally, they're not taxing them on this product, but we are collecting it and basically it's coming to my house. But if anybody wants to be part of this, just email me, just email Burnett Safety, Burnett like Carol Burnett without the money, and safety, it's all one word at Gmail, and let me know, and I will be glad to either come by your house and pick up the products, and I will give it to Nosh or to the Lutheran Church. But a lot of people have been saying that these things are needed within the community, which young women from middle school all the way to, you know, into their 60s, they need these products. They may not be able to afford them. So if you want to be part of this, I really would appreciate it. We are 23 paying members of Kiwanis, but there are 8 active members. So, so you can, so if you want to, you can also do it online. I've gone to Amazon. Amazon will, and it's very, very inexpensive. It's like $6 a month. So you can have a recurring delivery, and I would be glad to pick it up from your house. But I think it's kind of important for us to do this. And that's all I have to say.
Phyllis, did you check with Long Island Cares and Island Harvest? Because I know they got huge shipments of everything. I actually got a phone call last week again, in case they have those products there, because I believe they were influx.
Okay, because I know I've asked a couple of the big products, like, you know, Kotex, Johnson & Johnson, to donate. And they said that thank you very much, but our community was too small. So, you know, so we,
Melissa,
that's why I picked it up on our own.
Melissa, does Planned Parenthood do anything, give stuff like that out or have stuff like that?
In terms of menstrual products, truthfully, I'm unsure. I was actually going to ask Phyllis if she could type her email into the chat box, because I would love to connect and learn a bit more about how we can support you, whether it's personal or both with the organization. I think that would be great.
Okay.
There you go. Connections being made.
Phyllis,
that's why I joined.
There you
Phyllis,
go.
email Carolyn and we'll get that out, all your fundraisers on our pages as well.
Okay, like I said, it's called the Lady M Project. So
The board, did they pay their dues?
Kiwanis?
Give out more help.
I don't care anymore.
All right. So next, before we go to announcements, I know Ron has had something to tell us for the last couple of months, and our schedules have been busy. Is Ron still here?
Yeah, I'm here. Yep.
There you are.
I'm
Okay.
right next to you.
Do you want to do your quick spiel? Let everyone know what's cooking.
Sure. I've got a proposal. I sent it to Spiro, and Carol has looked at it. I think I sent it to Marina a couple months ago too. Just so it's a project that I'm working on that it's in the initial phase, but I figured before I got too far. I want to just get some quick reaction to it. And it's basically creating what I call it just a Cove strong movement, which is, I know there have been a lot of strong movements. People have started this in response to the pandemic, and there are certain crises like the Boston Marathon terrorism event and so forth. I've been thinking about this for a couple of years, and I just wanted to create a movement to basically support Glen Cove, but do a little bit more than that. So the idea would be that I with a brother-in-law of mine, I have a capability to produce t-shirts, leggings, mugs, mouse pads, a whole bunch of different products, which you can basically put logos on it. And so my thought was to basically create these products for people where the front would be, say, a t-shirt, it would be Cove Strong, and the back would be, your organization or agency. So it would sort of unite different organizations in a Cove Strong movement, with the idea that 25 to 30% of the proceeds would go to the organization. So I want to basically not just create a sentiment of we're all for Glen Cove. I mean, I know there's been a recent website, we love Glen Cove, which I think is great, but I want to also sort of create a vehicle for us to be constantly raising money for social organizations and agencies in Glen Cove. So that's the basic premise of it. And I have a proposal that Spiro and Carolyn have. I'm happy to share with people to get some feedback. As I said, I haven't worked out, the pricing of something like a t-shirt would be like in the range of $20. I think that would be, but then a quarter of that would go, if we sell it, then a quarter of those proceeds would go to the agency that's sponsored on the back of it. So, I know that fundraising is an issue that we are all going through, these days. And so this would be, another means of, creating kind of a constant stream of income, to various agencies. And of course, businesses could participate as well, but then they would make choices as to what agency they wanted to contribute to. So that's the nutshell of it. I know, as I said, Spiro, I'm happy to share this much more. It's basically, it's like a 3 or 4 page proposal. You can see what the mugs and the t-shirt look like. And as I said before, I just wanted to, let it out there, before I got too far, because I'd like to get some feedback and see if people have reactions to it, have ideas, suggestions, comments, criticisms, and so forth. So I thank you, Spiro, for giving me a little bit of a chance here. I didn't want to, take up too much, but I'm happy to, if people want more information, you can email me. I'm happy to talk with anyone about it.
Ron, do you mind just putting your email in the chat box? Maybe
Sure.
Whoever is interested, whoever has any feedback for you, they can just directly contact you.
Sure.
This way you get a better understanding if this is something worth looking into more.
Great, we'll do.
All right. For the most part, that's all I have. We'll get into announcements. Courtney did email me. Gabor, can you just check if Nash is a member? And if not, why not?
Nash is not a member.
They're not a member. Did anyone reach out for them to become a member? No. Courtney, you're muted.
I think they come under the inn, don't they? Don't they come under the inn? That's what was decided.
Courtney, you're still muted. I don't think you can unmute. I think you're having an issue. All right. So why don't Courtney, why don't you call Gabor or just email Gabor or Carolyn? Let us know how you want to do it. I believe Colleen is right though. When they first did, they were supposed to come in as the inn. If that's supposed to change, just let us know and we'll rectify and correct everything. And we will join. So we got another member. Thank you, Courtney. All right. So you're not going to go under the inn. It's a separate entity.
Right. We're,
oh, you got it.
Can you, oh, sorry. I couldn't unmute myself. So no, we separated from the inn like 2 or 3 years ago. and the North Shore Soup Kitchen is on its own. And NOSH is a program of the North Shore Soup Kitchen. So the North Shore Soup Kitchen is a member. And let me talk to Maddie about how that should work. And we'll do that because it's really important to us. And I apologize for not being in the meetings. I had a commitment at 9 that I finally could shift after a lot of time to be here. So thank you. This is a really, really vital organization. And thank you.
Thank you. All right. We'll go into announcements. I guess I won't go first. I'll let someone else go first. Who wants to go first? Tony. Go for it.
Hi, just want to put out there that any veteran that is looking to get the vaccine, Northport is finally opening up a little bit and showing some movement. And the phone number there is 1-800-551-3996. And they'll do a little screening on you to see if you're eligible. And it would take a ride out to Northport for you to actually get the vaccines. So Northport is opening up. You have to be, of course, a veteran and registered in their healthcare system. So that's it. Thank you.
Thank you, Tony. Anyone else?
Spiro, I can go.
Yes.
I just wanted to update everybody just on the senior center. We haven't gotten a date of reopening yet. I was hoping it would be this month, but I think what the county's doing is possibly waiting until the majority of people obviously have their 2 shots. As most of you know, St. Hyacinth had the vaccines last week there, so we were able to get about 70 of our members vaccinated. There's another one this week, I believe, at the YMCA. I don't think we're going to be able to get as many, but if you know anybody who needs the vaccine, any senior who does, please give us a call and we'll put their name and all the information on the list, so that if another one comes up, that we'll be able to get it for them. And I'll let you all know as soon as I hear from Nassau County when our date is. I'm hoping it'll hopefully be beginning of April.
Thanks, Christine. Amy's the only one that has her hand raised. Good job, Amy.
Thank you. So I'm glad to see everybody finally after my little journey. And it was a great podcast. Just want to let you know the Regency completed its 3rd vaccination clinic yesterday. So over 90% of our staff and residents are fully vaccinated, which is amazing. We had CVS come in and do the clinic for us. It was seamless and spectacular. And on Friday, we are now allowed to have in-person visits in the residents' rooms. So it's so glorious to be back in, a newly, COVID state, but it's so much freer and it just feels amazing. We've always been and continue to accept new residents for our assisted living side as well as our memory care. So if you have any loved ones or friends or families, just have them give me a call. Thank you.
Thank you. That's Jamie. Okay, so really quick, I just want to give a couple of announcements. If you guys have teenagers, grandkids, whatever the case might be, the city is looking for lifeguards. It's a hard breed to come by. If you guys know anyone that is interested in obtaining the certifications, they're open water certifications, pay is from $15 to $23 depending on experience. Please send them our way. We don't want any issues in the summer. We want to have as many lifeguards as possible so everyone can get out there and enjoy our beautiful beaches. This Saturday, baseball, junior baseball and junior soccer will have their last in-person registrations. Soccer will be at Village Square and baseball will be at the stadium. We're opening up field 1 so the kids can play some catch, get them out there. We hope to see you guys there. It's 10 to 12 for soccer and 10 to 1 for baseball. We were fortunate to have a lot of sponsorships, so we do have a couple of more free admissions for those that need it. Christine, I'll see you later. So if you guys have any questions, let us know. Lastly, Thank you to Danielle and Dr. Israel and the school district for getting the meeting together and for us moving forward. And we're very excited that we will have summer programs this year, just another step closer to back to normalcy. So we're finalizing everything. Again, Dr. Israel, thank you for allowing our junior soccer and the other and lacrosse to use the fields. So it
Yeah.
allows us to do more with our facilities as well.
Spiro,
Yes.
sorry, I have to hop, but thank you, Mike, for you guys being so accommodating for our kids. We are so happy to be getting back.
Thank you. On that note, summer programs, summer camps, of course, we're probably gonna need group leaders, youth service workers. If you guys have any kids, please have them contact us. Don't forget, our programs for the most part have been on a skeleton scale for the last year. So chances are a lot of people won't be coming back. So we will be looking and hiring to get these kids going again. So that's all I have for right now. I'm gonna have a lot more coming soon. Anyone else? Anything?
There's a blood drive with the Glenkova Rotary and Tiekerman Middle School, going to be on March 13th from 10 a.m. to 4 p.m. If you go to schedule an appointment, or you could pop in, but they kind of want you to schedule an appointment, nybc.org/donate. And again, it's on the 13th. I'll put it in the chat. And on another note, at Tiekerman, we're hosting a virtual gala on March 25th at 7 p.m. It's going to be a lot of fun. I'd really love to have each of you pop on and watch it with us. It's going to be a live and some recorded, but our host is live and we have a live auctioneer. I'll post it for you guys.
Thank you, Jamie.
Jamie.
I got it second time. Listen, it was, subconscious thought.
It's all good.
Anyone else? Going once, twice. Only went a minute over. All right. We will see everyone next month. If anybody does want to present in the near future, please let us know. We do have Gabor with a great presentation for us in the next upcoming. Dr. Israel, do you guys want to do your school budget meeting for May, as in the past?
I would say the answer is yes.
Good. So we already have you guys in there. I just wanted to make sure.
Yes.
Perfect. All right. Have a great week. Have a great month. If anyone needs anything, you know where to find us. Bye, guys.